As a Black man, in this day and age, there are so many issues that we are faced with.
The average life expectancy difference between an African American man and their counterpart, the white male, is 12 years. What would you do with 12 more years?
All of our initiatives, all of our programs, they were all developed in response to an issue that was happening in our community.
The African American Male Wellness Agency, we specialize in providing educational programming, testing, and resources, specifically for African American males and their families, in an effort to close the health disparity gap in our community. Originally, our parent company, the National Center for Urban Solutions, started off as a workforce agency, working to help get African American men and women off public assistance, employed and self-sustainable. And so what we identified is that it's hard to do that when there are other underlying issues such as health. Our walk began in 2004 as the result of a research project that our founder and president, Mr. John Gregory, did. He took 100 African American men and he employed them for 26 weeks.
When the guys told Mr. Gregory, it's like, yo, Black men are dying and nobody cares. Mr. Gregory took a step back and asked, he said, well, why are they dying?
As a result of that project, 90% of the men revealed that they had an elevated health level in some way, shape, or form, whether it's blood pressure, glucose, BMI.
It was from preventable things that could very easily be discovered and addressed if the men had just gone to get health screenings and gone to the doctor.
Traditionally, African American males and their families are at the bottom rung of the health disparity gap on a number of different levels. So you're talking about physical health, mental health, financial stability, life expectancy, infant mortality.
As the African American Male Wellness Agency, we're addressing the health barriers. After the health barriers, we're addressing the mental barriers. We're addressing the economic barriers with workforce. And it makes for a holistic approach.
African American males traditionally are very hard to reach, are very hard to engage just because a lot of mistrust.
The racial inequality that we've experienced, the physical trauma that we have experienced, all plays into our physical well-being as well as our mental well-being. So when you put that all together, you see the disparities.
Being residents in these communities, being members of the Black community, we're in these environments every day. We're meeting these people, or we've gone to school with these people, or we've worked with these people in the past, or we see them in our neighborhoods. When we come with information or we come with services, because of the relationships that we have, people typically trust us.
It's also about our approach. We're going out with a smile and handing out material and saying, hey, this may be helpful to you.
We know that the best way to reach our people is to go and talk to our people. That's what everything at this agency is about.
Meeting people where they are. Going out on a daily basis, on a weekly basis, on a monthly basis to the community, going house to house, store to store, and talking to people and passing out the information. Not only are we doing that, but we're bringing our partners with us, such as NAMI, taking their information, and we do it in a way that the people understand us.
Put it in somebody's hand, let them know, say, hey, we're doing this because we care about you.
That belonging piece, that relationship piece, that engagement and interaction piece is what we do well across all of our programming, and that's what ties back so closely to the mental health approach.
And so we talk often like, all right, let's heal. But then we don't talk about anything that's going on.
In our community, the Black community, African American community, we have a stigma about mental health because it is almost considered a weakness.
We don't say like what our issues are. We don't say what our anxieties are, what our fears are. We don't talk about the trauma from our past. We don't talk about what keeps us up at night.
The trauma that we've have experienced, be it related to police brutality or COVID or just losing a job, the violence in the street among African Americans and then within the community. This now becomes a serious conversation of our mental well-being, our state of mind.
We want to take those conversations that are happening inside of us and have them outside of us with our community.
We need to listen, not just to listen and not just to understand, but we need to listen so that we can make that person feel as if they matter, because they truly do. So whether we're talking to people about fatherhood, whether we're talking to them about finances, we want them to feel comfortable. We want them to feel welcome, because that is what allows them to open up to us and for us to get them the help that they ultimately need. We have been doing a lot of work with barbers as it pertains to mental health and engaging men.
In the African American community, the barbershop is a place where you'll have men, women, and children go, and it's almost like a opportunity for them to talk about anything and everything. That was our starting point to talk about mental health.
We work with the Ohio State University, the Star Center, to provide a mental health training around trauma and first aid. And so we provide these trainings twice a month for barbers and beauticians completely for free, and they can earn a certification. We've empowered these people to be advocates of mental health, and that way they can go out to the community and help people that they serve to get resources that they need to improve their mental health.
The fatherhood program, the one that I'm over, we were having something called the Dad Call, and men would call into our Zoom and we would just have conversations about being a dad. Dads are sharing their mistakes and their concerns, their worries, their fears, their success stories. If you have other people going through the same thing, not only do you have an opportunity to hear about what their solutions might be, you also just don't feel alone, which is, nobody wants to be alone. When we host events, we don't want there to be any barriers of entry because we're trying to reach them. We want them to know that these services are here.
I think the greatest part of what we do is that everything is free. And so we've alleviated the financial barrier that sometimes discourages people from accessing these resources. With the African American Male Wellness Walk, it started here in Columbus, Ohio in 2004. We are currently in 16 cities across the United States. In 2019 here in Columbus, we served 30,000 people at the walk. We were able to provide over 4,500 individual health screenings. And those health screenings really go a long way in changing lives of people because we're able to provide better care. We're able to make referrals to primary care physicians. And even in some circumstances where we have to call, an ambulance or an emergency vehicle, we save lives. We look at it from a standpoint of we come in and provide assistance and provide resources. Our ultimate end goal at the end of the day is that the people will take these resources and become kind of independent in their own way of handling their health and wellness.
Helping another man that looks like me, that has some of the same experiences, is a great feeling. And not only that, then I'm able to, by helping him, helping myself, I help the community. We become good stewards of the community. And by making a community better stewards of the city, of the state, of the country, then, it all helps everyone.
There are a lot of great agencies in town, but I know one thing is that we work with partners who are not necessarily trained or commonly work with African Americans, but we kind of help guide them along the way. We help them speak the speak and walk the walk and talk the talk, and kind of encourage them to say, hey, here's some best practices, or here's some things you may need to know when dealing with this particular group of people. And so I think as opposed to maybe reading a book or doing a webinar, it's actually getting out into the community, working with these community partners that serve these groups, and they'll give you a greater understanding on a first-hand level.
I would ask partners to understand what we're doing, how it works, what our mission is, what our goals are. Have an open mind and an open heart about what we're trying to do, and partner with us, because we're doing good things, and not just for us, but for all that we serve. Health and wellness, fatherhood, jobs, addressing alcohol and drug addiction. Those are all important things, as I've always said, not only just for our community, but for all communities. And if we work together, we can do great things.